So, good evening, good afternoon, and good morning. Thank you for joining me at this point. I want to discuss on the treatment modalities used in psychiatry. I was able to explain that we have two basic major modalities that is being classified and among the methods of treatment in psychiatry, where I said one is somatic and the other is non-somatic. I also said that the somatic classification can also be called physiological or physical methods or modalities used in treatment of patients in psychiatry. I also classify that of non-somatic as psychological method or environmental methods. Why did I classify these modalities differently? It's because we're able to analyze that there are some treatment methods that come in contact with the body of the patients, and these methods are basically those methods that we call somatic, that is body. Soma, the term soma comes from the body, and physical because they touch and they can also be seen physically closer to the body of the patient. Physiological can be due to the processes it undergoes, the system of that individual. Like when you take drugs, it undergoes some physiological processes. That is the area we have some terms like like pathophysiologists, because they undergo some physiological mechanism or methods upon which the individual will not understand, because this particular instrument is passing through some metabolic processes in the system of that individual. Then we still have those ones that I classify as non-somatic, psychological, or environmental. I say they are those treatment methods that does not come in contact with the body of the patient, but they also ensure that there are some behavioral modification or behavioral changes. So I now say example of them is, okay, before I mention the example, let me tell you, I said they are called psychological because they are more psychologically oriented, and environmental, most of the adjunct therapies are those ones that utilize the environment where the individuals are. So I now mention the types of classification that we call physiological or psychological, physiological or somatic, as well as physiological method or non or somatic method. Example of them are drugs or medication or psycho or pharmacological method. Then we still have things like electroconvulsive therapy. We have restraint or mechanical method called restraint. We have insulin therapies, even surgical methods. The use of surgery in the treatment of patients is also a very important method in this topic. We still have where we will talk about betting, old age classification, massage, yes, body massage. We still have the one that call flogging of a patient, which is obsolete currently. But we have the non-somatic are basically psychological, which I say psychotherapies and its subtypes. Then we have things like cognitive psychotherapy, behavioral psychotherapy. We have cognitive behavioral psychotherapy, which is combination of two. We have psychodrama. We have dancing therapy. We have recreational therapy. This one and they are basically the utilization of the environment of an individual. Meditation, which is called mindfulness. We still have yoga. We have a method I will call occupational therapy. Here, the individual learn or is being taught to learn a particular skill that will enhance the individual to concentrate as well as become more productive after discharge. We have activity or diversional therapies and each subtypes like recreational therapy, operation, you can see things like operational therapy there, you see things like social therapy, even exercise is also a type of therapy. Sometimes when you are stressful, like for addicts, we advise you to go into some minutes of exercise, like 30 minutes to 1 hour exercise. You see that there will be conversion of endorphin to dopamine, or definitely there will also be the possibility of, because of the exercise, that thought of having that addictive substance will now evaporate. So because it is useful, we now advise you to go into it. We have so many of them. We have family therapy, we have relational therapy, we have couple therapy as well. Most of these therapies are therapies that are very, very important in the treatment of patients with psychiatric illness. So this is very, very important. So in my next video, I'm going to talk about the use of drugs as a very important aspect of treatment of patients in psychiatric hospital or in psychiatry at large. Thank you.